Good morning, everybody. So I love the way the room is set up, except I wish you were closer to me, but I'll let you stay where you are. Thank you for that nice introduction. You will hear my New Jersey accent frequently as I talk today. They say as I get tired, it comes out even stronger. So see if that's the case, because I am a little pooped today. I drove last night from Truckee here, so if seem a little spacey sometimes, forgive me for that. So yes, I have been the Strengthening Family State Lead for about a year and a half now. I moved from New Jersey in 2009 to South Lake Tahoe, California, and at that time I retired and I was taking care of my mom, who lived in Reno and had a lot of health issues. And I took care of my mom for a few years, and then after she no longer needed me, I decided to go back to work, and I was really fortunate and very, very lucky to be able to take a job going throughout the state of California and talking about the Strengthening Families Framework. So it's really an honor to be here today and talk about that. My Strategies is the agency that I work for. We have a little bit of an interesting structure. Has anybody taken a strategies training? Got one person, okay. Well, I would very much encourage you at the back of your PowerPoint, which you have copies of, we have our website, and you can go on our website and you can learn all about the different trainings that we host. Very, very many trainings throughout the state of California. Strategies has 3 regional offices. So the office that I work in is in Paradise, California. Anybody know Paradise? No? It's by Chico. And my husband likes to tease that I live in Paradise, South Lake Tahoe, and I work in Paradise. So it's true. So I'm a very lucky person, but the Strategies office in the northern region is in Paradise. We have a central regional office, and that's in Camarillo. And we have a southern regional office, and that's down in Anaheim. And all of our Strategies offices do the same general work. We provide training, services for children and families, and we also provide technical assistance, and not technical assistance in the sense of like your IT or your information technology, but technical assistance to kind of help programs and services again, improve their programs. And that's why I have this little helmet on the slide, because when I first went to work for Strategies, I was trying to describe to people what I do. And there was this TV commercial that you may recall where it's a plastics company, and they show these little kids in helmets, and they say, "We don't make the helmets, we make the helmets stronger." So I kind of feel that's the way Strategies is. We don't provide the direct services, but we work to make those services stronger by providing training and technical assistance. So we are funded by the Office of Child Abuse Prevention, a state entity. They receive federal dollars, and those dollars come through them, and they fund us, and they fund many, many other projects, including a Parents Anonymous parenting project. They funded parent leadership training throughout the state of California, and all the work that they do really seeks to promote strategies that prevent child abuse and neglect. And the Strengthening Families Initiative that I work on, and I have colleagues throughout the state that work with me, that it's one initiative of Strategies and one initiative of the Office of Child Abuse Prevention. And the Strengthening Families Initiative started in California probably like in 2005, but it started nationally through the Center for the Study of Social Policy. Has anybody heard of the Center for the Study of Social Policy? If you have, just put your hand up, okay. They are a national organization. They're private, but they basically, as their name is pretty clear, they do research that seeks to develop policies that promote child abuse prevention, child welfare, improvement in child welfare services, and they have been working on strengthening families since 2001. So we'll talk a little bit about that in a moment. And if anybody has any questions, we can keep it as informal as possible. Please just put your hand up anytime, stop me, and I know we may get questions from the virtual audience as well. Okay. So what are we going to do today? We're going to make sure that by the time you leave here, you understand the Strengthening Families Framework and the 5 protective factors. And one of the things that's really important to me in my presentation is that you understand how the protective factors help prevent child abuse and neglect. So that's really an important piece. The other piece I really want to emphasize is how strengthening families relies on parent engagement as a foundation. And most of you folks are in early care and education, or education, K through 12, and you have been way ahead of a lot of social and community and other service providers in engaging parents. I mean, clearly, parents are that first teacher, but parent engagement is really critical in strengthening families. And then I hope that you also have, you think a little bit about what you can do in your own work to try to help promote protective factors. Because one thing I want to emphasize throughout my presentation is that building protective factors is nothing, it's not rocket science, it's something you're already doing, it's something we all do every day in our work. It's just, the Center for the Study of Social Policy, CSSP sometimes we call it, one of the things that they really talk about is that it's about being intentional, and it's about just recognizing that these protective factors that we'll talk about are really critical in helping promote healthy families. Okay. So just take a quick moment. Oops. I think I'm on a timer because it does this to me sometimes. I think it's a ghost that comes in and moves my slides. So when I go back and forth like that, I have to fix that next time I do a presentation. Can you give me a sense from the folks where you're at in terms of your knowledge of strengthening families and the protective factors? So we have these 5 levels of involvement. Just putting your toes in the water is kind of, this is the first time you've heard about it. The second is waiting. You might have heard about it and you want to learn a little bit more about it, but you have heard of strengthening families. Recreational swimming. Sometimes you use strengthening families in your work, or maybe you do some parent engagement activities. Swimming laps. You use strengthening families kind of every day in your work. It's really something that you really focus upon. And then last but not least is getting ready for the Olympics, which is strengthening families is at the center of your life. And that's supposed to be me. And if anybody else in the audience is there, you should probably go to a different workshop. But how many people would say they're in the number 1? I'm just putting my toes in the water. Okay, that's good. I like that. 2, waiting. Okay. 3, recreational swimmers. Okay, so we got some folks that are using it and know about it. Okay. Swimming laps. All right, I got somebody up there. You can come and help me. And getting ready for the Olympics. Hope nobody else. If you do, you need to come to the front. Okay. All right, well, that's helpful because we're really going to be doing a very introductory presentation, okay, about the protective factors. There's lots and lots of ways that you can learn more about them, and one of the ways is we have a lot of trainings, but also locally, many child care resource and referral agencies throughout the state have been trained on the Strengthening Families framework as trainers. So you can get, in almost every county, your child care resource and referral agency probably has somebody that's been trained in strengthening families. And I know Santa Clara has. So what I want you to do as we talk about strengthening families, I want you to think a little bit, before we start, about a family that you have worked with. Maybe you're working with them now, maybe you've worked with them in the past, maybe it's you, okay? Maybe it's your own family that has faced a particular challenge and you have felt it's difficult to support and help them, okay? So if you just take a minute and think about that, just try to think of anybody. And again, for me, when I started with the Strengthening Families Project, I really realized how much my own life was influenced by protective factors. And I'll talk a little bit about that. But when my son was about 18 months old, his dad and I separated, and it was really, really very difficult for me and traumatic for me. And I look back at that time and I think about the protective factors and how much I had in my own life that made it really easier for me to deal with a very, very difficult life situation. So think about a family, whether it's your own, somebody you work with, et cetera. And then we'll as we go through, I hope we can kind of come back to that family and we can and think about how you either are using protective factors or how you could use protective factors. So this slide really starts us off on the Strengthening Families framework, because when the Center for the Study of Social Policy was looking for something that would really help empower families and help families that were struggling and help all families, They went to Prevent Child Abuse America. And Prevent Child Abuse America is a great organization. Their website is wonderful. They have a lot of good information. And one of the things that they looked at was, how can we positively message about child abuse and neglect prevention? What kind of message can we send to people that will be received and heard and maybe acted upon? Because we all know that we can talk away, but a lot of times people aren't receiving our message, right? So the things that they talked about were these three basic components. So, nope, we gotta go back. Sorry about that. I really apologize. So one thing is that effective child abuse prevention, it shares a strong vision of a community. And we all know, and you know in your work, that parents can't do it alone. We live in a very, very complex, complicated society, and we need help. We all need help, right? We need help getting our kids to school. We need help understanding what the rules are and what the things are that we need to do with our children and families. And it really helps when we have a community around us. The other thing that was really positive in child abuse messages that were received by people, child abuse prevention, is that you look at and focus on situations that are common to many parents. So it's not about those families that abuse their children, but it's about all families, and that all families are at risk, and all families face struggles, and all families need help sometimes. So it's really not an isolating message of, like, I remember there was one message that talked about had a little toddler with a broken arm. Yes, that is child abuse, and clearly we want to prevent that. But in many, many ways, what we're talking about is helping all families promote well-being for their children, the best family environment. And then the last thing they talked about was to be careful with calls for action. So if you talk about, report child abuse now when you see it, if you see somebody doing this, report it. Again, that's really not that helpful, and it certainly isn't preventative because you're reporting something that's happening now. They really wanted to focus in on, how do you prevent child abuse and neglect? How do you help families so that they don't get into that situation where somebody has to contact Child Protective Services? I mean, obviously it's important that that happens when you see it, but it's also really, really important to help try to strengthen families. And the Center for the Study of Social Policy realized that working with these three kind of components, that the strengthening families was the framework that really encompassed these three messages. So I just want to start you with a little bit of a history. So again, the Center for the Study of Social Policy started this project. They were funded by the Doris Duke Charitable Foundation, specifically to identify and develop look at a framework that really could address child abuse and neglect prevention. So what they did was, they started in 2001, and where they started was early care and education programs. So why would they start in early care and education programs? That's where a lot of children are. There's no stigma to being there. It's not like you bring your child to a child care provider because you need help. Many, many families go there because they're working, or they want their child to go be in preschool, et cetera. So there's no stigma associated with it. And because this is where you could find families and really build a trusting relationship. So they started looking at early care and education programs, and one of the things I just want to distinguish is that the Strengthening Families framework is an evidence-informed approach. It's not an evidence-based approach. And that's important for CSSP as we talk about this framework, because they have not yet, although they are working now on some random studies where some families get the Strengthening Families framework and the protective factors, and some families don't. And that's happening now in a few states. So down the road, it could be evidence-based. But what they really did was they looked at the research, and they looked at exemplary programs throughout the country, and they identified what are the common characteristics of these programs, what make these programs work. And they looked again at programs that were successful. So that was how they started it. And they went through this for about a year before coming up with the Strengthening Families framework. And they started out with a literature review and these dialogue sessions. So the literature review was done by the Erickson Institute. Have you folks heard? You've probably heard of the, if you're in child care, they have a huge child care educational, child development educational program. So they conducted a literature review. They looked at literature around what helps make families stronger, what helps children succeed, et cetera. And then they did these dialogue sessions, and they talked to, all different organizations throughout the country: Child Welfare League of America, NACRA, National Association of Child Care Resource and Referral, Prevent Child Abuse America, 0 to 3, et cetera. So they went throughout the country and talked to all these different national organizations, and many of those organizations are partners with us. So if you go to the 0 to 3 website, or if you go to the Center for the Study of Social Policy's website, we're always referring back and forth to each other's material because we're partners and we work together, because so much of our material all works together to promote strong families. And then, as I mentioned, they looked at these exemplary programs throughout the country. And I put this slide up because I just thought it was so interesting. The Center for the Study of Social Policy put out a study, and they looked at early care and education programs, and they looked at what makes programs, the best programs. And the really interesting thing that I thought was, I like this quote, that research has shown that child care quality may be a more powerful predictor of child outcomes than characteristics of the family, home environment, especially for low-income and minority kids. So that was one of the things that made them focus on early care and education, looking at this is a place where you can really, really make a difference in the lives of children and families. That was really, really helpful. The other thing that they looked at with early care and education programs that were what they considered high quality is, they said that when they worked with families, they weren't focusing on families' deficits. They were trying to find what's working in this family and build on those family strengths. So that was one of the things that they identified. They also looked at these programs that had become a resource for all families. So they were like a community center. They went beyond just being a child care program. And you'll see that across the state where you have schools that are becoming family resource centers. So it becomes a hub for the community, and that was really powerful for families. And they also, while they really worked with all families and resources for all families, they focused special emphasis for families that were addressing challenges. So, who are those families? So you have families that are in poverty, families that are in the CalWORKS program, families that are in Child Protective Services, families who have children that have a special need. So, the families that you work with every day, and you see in and out, they try to really focus in and try to help those families and give them some of the services that they need. They promoted a teamwork approach between parents and teachers. And again, when you look at the educational world, you're way ahead in terms of parent engagement because you've had, how long have PTA, PTOs been in place, et cetera. Head Start, works so much on family engagement. But this was really key because, and it's really a foundational thing for strengthening families, that you can't strengthen families if you don't include parents, include them as a part of the program. And they also recognize that one of the key factors for families that were involved in these exemplary programs was that their social isolation was reduced. And one of the protective factors we'll talk about is social connections. And sounds very simple, right? That if you're isolated and you're lonely, you don't have help and support, you're going to be at a higher risk of child abuse and neglect. So they looked at what works in real life with real families. That was important to them. Okay. One of the things I wanted to mention here as well is the state of Illinois was an early adopter of the Strengthening Families approach. And they did an initiative between their Child Protective Service agency, everything there is state organized, and their early care and education community. And one of their real focuses, and I think this was very, very innovative and exciting, any child who was in Child Protective Services who was between over the age of 3, clearly if you were in school, school age, you had to be in school. But they mandated that children between 3 and school age, when they were eligible to go to school, had to be in an early care and education program. And the reason that they did that was, well, there's many, many reasons, and they came up with actually a training program for their child protective service workers, 10 reasons why you want to partner with early care and education. Because there's just so many benefits for children and families to have the family be involved in early care and education. One of the roles that I have as a volunteer in my community is I'm a CASA, a court-appointed special advocate, which is for kids that are in the foster care system. So I work with families, and I try to help and support them, try to strengthen the families. And one of the moms that I worked with was homeless for a while, which, being in South Lake Tahoe and being homeless in the winter is really rough. We have no shelter. She, fortunately, the children would be with Dad most of the time, but there was a lot of time that they were out walking the streets because she had no place to go during the day. So they utilized community resources, the library, et cetera. But one of the really great supports for her was her early care and education provider. Would pick her up, would pick up the kids, would take her to work, just a real resource for her. So I think about that as, and this was just a family daycare provider. This woman was not in a center even, but she was there for Mom, and she really, really tried to help and support her, and it meant a lot. So this is a little map. Oh, thank you. Here's a little map of these are some of the exemplary programs that were identified, and you will see 4 in California, 3 in the Bay Area, and 1 down in, I think Children of the Rainbows down in San Diego. But the Early Childhood Mental Health Program, that one, Contra Costa County funds their first 5. They fund a mental health provider who goes into the child care centers to try to help when you're seeing children with behavioral issues, try to help the family and the child care provider so they can work with the child and keep the child in the program. Let's see if there's anything else I need to stay here. So just as to say, CSSP, they surveyed the states, they went out to over 200 programs, and then they did site visits with these 25 programs. And what they came up with was the protective factors. So they came up with the Strengthening Families Framework and the 5 protective factors, which we're going to talk about a little bit more. One of the things I just want to mention to you is if you go to the Center for the Study of Social Policy's website, and the link is in your resources on the last page, as well as on the Edmodo site, there's a link to the Center for the Study of Social Policy's website. Every year they put out a document, Strengthening Families and Communities Resource Guide. So the 2014, I think it comes out in like April. And it's published along, I think in partnership with the Administration for Children and Families, federal government, because again, that's one of the partners. So I'd highly recommend going up to their website. It's a beautiful book. You can order a copy of it if you would like it, or you can just download it as a PDF. Okay, so we'll talk about the protective factors, but you should have, this is very hard to see, I know, and I apologize, but you should have a copy of this. This is the logic model, the Strengthening Families logic model. And this is, again, this is developed by the Center for the Study of Social Policy in partnership with another organization called the National Alliance for Children's Trust and Prevention Funds. So a mouthful. But they also, that organization, and you have them in your resource page, National Alliance for Children's Trust and Prevention Funds has an online training that's free that you can take on the protective factors. And it's pretty fun. It's interactive. It's pretty cool. So also, I had mentioned that the child care resource and referral agencies throughout California were trained to be trainers in the protective factors, and it was through the National Alliance of Children's Trust and Prevention Funds that they were trained. So just as an FYI, they provided us with this model. Everything they do is in partnership with the Center for the Study of Social Policy. So this basically shows you what you need. This is the ingredients for developing a Strengthening Families program in your own home, in your own community, in your own agency. So up here they show you the program strategies. And these are 7 program strategies that they identified that when you do these strategies in your work will help you to build these protective factors that we're going to talk about in a moment. And then these protective factors are what help to strengthen families, help optimal child development, and of course reducing child abuse and neglect. So the 7 strategies, and they each one, well, the way that the National Alliance frames this for us is they tend to take a few strategies and say, for example, facilitating friendships and mutual support, well, that helps build social connections. That helps build parental resilience. For me, the way I read it, every one of these strategies helps to build a protective factor. You know, they're all interrelated. Social connections build resilience. Social connections help you understand parenting and child development, right? Because you're with other parents maybe, and you're seeing other children, and you're like, oh, my child does that too. I thought that my child had an issue, but I guess all kids do that. I didn't realize. I thought it was me. That has happened to me numerous times. So these 7 strategies build the protective factors. And one of the things, again, to just emphasize is that you're already doing these 7 strategies. So you're doing them in your work. The protective factors and the strengthening families framework is really about being intentional. Thinking about, okay, I'm actually, as I say, something that I thought I was doing just naturally is actually helping to build a protective factor. So for me as a CASA, I just naturally try to help the families that I work with link up to concrete support. If I go into their home and it looks like they don't have food, or it looks like they need a resource, or I hear that the child needs a doctor and there's no doctor, I just try to help identify that concrete support. But what the Strengthening Families Framework really tries to have us do is be intentional about that. Think about, okay, how am I helping to identify concrete supports? How am I helping that family to build social connections, find family members that maybe can help them so they're not so isolated? So we're going to start out now. We're going to look at each protective factor. And for each one, I just basically have a brief slide, and you have this material where we talk about, what does the protective factor look like? And then how does it help families prevent child abuse and neglect? How does it buffer families? Because really the protective factors are sort of your anti-risk factors. They're your inoculation against risk. And then what you can do in your own work or your own life to try to build these protective factors. So the first one we talk about is parental resilience, because it's sort of like, for me, it's where it all begins. And what it looks like is, you're able to, we say, think about an egg versus a tennis ball. If a resilient person, if those life traumas that we all have, there's nobody who does not have trauma and stress in their life. But a resilient person, when that trauma hits them, they can bounce back. A person who's not as resilient, think of the egg, they crack, right? And, we all, for many of us, we think that resilience is something that's innate. I always, was raised like that. Oh, this person's really strong. I remember when my father was very, very sick, and I just couldn't stop crying. He was in the hospital, he was in intensive care, and I was young, and it was the first time that this had happened to me, as have a family member facing a health crisis like that, and I cried, and I cried, and I cried. I cried so much I couldn't stop crying. I mean, I couldn't even imagine that you could cry this much. And my mother said to me, I thought you were the strong one. And I said, I guess I was. I thought I was too. Well, what I found out, and this is how you build resilience, yeah, I did that for about a day and a half. And then the tears dried up, and then I was able to move on. So what I learned about myself was that crying wasn't weakness. That was my strength. That was my ability to really feel my feelings, process them, and move forward. And I kept that with me. And I know now when I'm facing those crises we always face, we have families, loved ones that are sick. We all face these things. I've learned that I have a certain pattern, and that's my resilience. So it looks at hope and optimism, your ability to become calm. So the other day, I do a lot of driving for work, and I'm from New Jersey, and we have a lot of traffic in New Jersey, okay? But California, I've never seen traffic like you all have, okay? Everywhere I go, there's traffic. It doesn't matter. I'm in South Lake Tahoe the other day, leaving my house to drive to Truckee, and I get stuck in this road work traffic, 7:30 in the morning. I start, you know, that feeling you start getting, right? You're like, I'm gonna go crazy, I can't take it anymore. But I was able to maintain and restore calm without utilizing drugs or alcohol because I had to work that day. So it's really about, you know yourself. So yeah, you get that feeling, you feel yourself, and you start. For me, it's the breathing, the yoga. I try to go to that loving place. So, and then also a future orientation. That comes back with the hope. So you think about the future. You're not just sitting here saying it's never going to get any better. I'm never going to be able to overcome whatever the issue is. And then because we're talking about parents and parental resilience, it's about having a positive attitude about parenting. And again, particularly when parents are dealing with stress in their own lives or in the lives of their children, it can be very hard to be positive about parenting. Sometimes parenting's really tough, and you can get down on yourself and you can get down on your kid, and it's really about being able to come back and look at your child and maybe laugh and then do something fun, have a fun activity, and move forward. Okay. The other thing I just want to mention, you talk about that concept of learned helplessness. Where people are kind of told, oh, you can't do this, you're not going to be able to do that, so you basically just give up and say, you know what, okay, I can't do it. Resilience is the opposite of that. It's that empowerment. It's that I can do it. It's hard, it's going to be really hard, but I know I can do it. So how does it buffer families against child abuse and neglect? And I just want to thank the Lake County Child Abuse Prevention Council for these pictures on the buffering slides. They're all the little animal pictures. They're really quite cute. They did a whole public service message about the protective factors with these cute pictures that I think are great. So it buffers families because it helps parents to overcome trauma that we all feel and stress. And particularly when the families that I work with that are in the Child Protective Service system, invariably they have more stress than the average family. They've got income issues, they've got substance abuse issues, they've got mental health issues. There's a lot of stress, domestic violence, etc. So resilience really helps people to overcome a lot of those stresses. Oh, thank you. Mm-hmm. Oh. What do you do personally to help the homeless single mom? How many kids did she have? Did she end up getting a place? Yes, she did. What I did personally, when you're a CASA, it's kind of, you have to have those professional boundaries, which we talk about with social connections. It was very hard for me having a home not to want to take mom and the kids home with me, and say, come to my house. We're not allowed to do that. So what I did with mom, and I advocated at the Child Protective Service Agency for her to get moved up on the Section 8 list, because that's one of the benefits of being in the CPS system is there are services that are available to families that are in Child Protective Service that may not be available to others. So she was able to get moved up on the list for Section 8, and she did eventually. It took about, I would say, probably took her about 4 months, but she did get a really nice apartment, and that's where they are now. And she had 2 kids, and they were little. So, thank you. I just wanted to talk about this piece here on mitigating the impact of violence in the family or community. We need to think about the impact of living in communities where children experience violence in the streets. We all understand now, when I was a young social worker in Child Protective Services in New Jersey, believe it or not, a domestic violence case that involved just mom and dad did not rise to the level of removing the children from the home or opening up a child protective service case. At that time, the thinking was, it's not optimal, but the child's not being physically injured, so therefore the Child Protective Service Agency wouldn't come in. Nowadays, that's very, very different, okay? If there's domestic violence in the home and children, particularly young children, are seeing it, are experiencing it, we all recognize that affects the child's brain development, it affects the child in so many ways. So, Child Protective Services will enter the home and will try to help the family. But, a lot of our families live in communities that are violent, where children don't have a place to go out and play, where children don't have the ability to feel safe in their neighborhood, where parents can't feel like their child's safe. I grew up in a time where, you went out, you just went out. I mean, my mother threw us out of the house. That was it. You're like, goodbye, go out, come back when the lights come on. I mean, how many people grew up in a neighborhood like that, right? Time where you could just... That was a luxury. That was a wonderful luxury that children don't have. And in some places, children are afraid to go to the park, walk to school. So you need to think about how we can help families and how we can create those safe places where families can be. And to me, the school, the child care center, that's what that is. That's that safe place for families and children. And then, of course, the other way that we buffer is you're giving parents hope and you're reducing the use of negative coping mechanisms. Some 75% nationally and even higher in South Lake Tahoe, where I live, of Child Protective Service cases involve substance abuse or mental health. And many times the mental health and substance abuse are together because of the substance abuse helps deal with the person deal with their mental health issues. So we really want to help people come up with other ways to cope that really develop resilience. Okay. Oh, hold on. Getting to the next page. Okay. So, and then what can you do? And, these are really simple things. How do you create resilience? It's about showing people that they're valued, that help is available, giving people hope. Building trust, because if you can't help people identify and perhaps access some of those services they might need if you don't have a trusting relationship with them. And then finding those folks that are isolated, those families that are kind of on the fringe, and really trying to pull them in and into the system. For me, I think about as simple as this. Like, you go into a restaurant, right? And you go to the hostess or host as you walk in the door. And it's the difference between a person who says, hey, how are you? Welcome. Come on in. And somebody who has their head down. And, you stand there and you're like, what am I supposed to do? Like, are they going to ask me to come in? And sometimes, have you ever gone into a place like that and actually walked back out again and never had the person look at you? I mean, I have had that happen. I'm like, I don't really feel welcome here. It's about how easy is it for us, right, to make people feel welcome and to make people feel valued and feel good about themselves. And, there's that old, not that old, but there's the saying, it's not really what we say to people, it's how we make them feel. And how true is that? That it's really about how we make people feel. And then social connections. I mean, how important is it to have social connections? And clearly, what are they? Well, it's simple, right? It's being around other people. But we focus on positive social connections for positing parenting norms that provide support and help. A lot of the families that deal with a lot of stress, that are using substance abuse, are using drugs or alcohol, they may have social connections. They're just not positive social connections. They have toxic social connections. So you really want to have folks around positive people in their lives. And again, that's where schools have such a great opportunity. Where I work up in Paradise, we are in the Family Resource Center, and they have parenting groups. They just bring the parents together and they talk about a particular topic. It might be, something about, disciplining your toddler or different things like that. They just have a little, a topic, and they go over for about an hour. And that's great because the parents get education. But what they also get is they're around other parents and they get to see other kids. And it's positive. These are other parents that are trying to learn things and trying to really improve their parenting skills. So that's very, very important. And one of the cases that I had as a CASA that really demonstrated the power of social connections was a dad who was a single dad of a 6-year-old boy. And this little boy was in the principal's office probably half his school day for bad behavior. You know, he was hitting the teacher and hitting other kids and just not acting as he should. And when I became involved in the case as the CASA, this dad was so isolated. He was a young guy parenting this little boy. Mom was out of the picture. He had no family in the area. He had lost his job, and he had recently separated from a fiance. And one of the things we talk about with social connections and how social isolation contributes or doesn't contribute to child abuse neglect, we look at you know, sort of which came first, the chicken or the egg. Are you socially isolated because you're abusing your child, or are you abusing your child because you're socially isolated? And this young man was sort of a case of both, where I wondered after I met him if maybe that girlfriend or fiance had left him because of the way he treated the little boy. You know, which came first? But for me, it really comes down to isolation as a high risk factor. This situation, in this young man's case, his family came and moved. They didn't know what was going on in his life. I have a 28-year-old son, so I know often if I don't hear from if I do not hear from him for a while, usually things are going really well. Okay, he calls me when there's a problem. In this particular young man's situation, his parents thought things were going fine because they hadn't heard anything from him in a while, but things were not going well. So they came up and they moved up to Tahoe, and they took care of the little guy for a while Dad got himself together. This little boy's behavior changed so dramatically when his grandparents came to take care of him that the school, nobody could believe it. And even Dad, who really didn't feel that he was abusive, which is very typical with most of the people that I work with, they don't think they've abused their children. A lot of times they just think they're disciplining their children. When he saw the change in his son's behavior, that's when he really said, okay, I wasn't parenting as well as I could. You know, I may not have been abusive, but I wasn't parenting as well as I could. And that's what I think was so powerful about social connections. It was just amazing to me to see the change in everybody. So clearly, you know, social isolation leads to abuse and neglect. Positive relationships reduce stress. I mean, we feel better when people say nice things to us and we're having a good day. And then, of course, this research here that shows a link between positive contacts and decreased child abuse and neglect. There was research that was done that actually looked at moms who had been in the Child Protective Service system. So they were, you know, had open cases. And what they found was on days where they had positive interaction with other people, their incidence of, you know, negative interactions with their child went down. So that's the power of social connections. And it's an easy thing. It's something, you know, you don't even think that you're doing something special. You think it's just what you do. But for a lot of families, they really need those positive connections. And what you can do, obviously, is create opportunities for people to have those connections. And schools are so far ahead on this. I just have my own little plug. One thing I've noticed, and I'd love to hear from the audience as educators, you know, the parents that I deal with, and I had the same thing, I have to say myself, but I had one child, and so I could kind of deal with it. But homework time is so stressful for so many families. I don't know if families tell you that, you know, how stressful it is. The little boy that I talked about at first, you know, with the dad, homework time was really hard. And that's where they had these tense arguments and fights. And then I see with a lot of the families, if they have multiple kids, it's just really, really hard for them to provide the kind of attention that the child needs for their homework. So I just give a plug that as educators, and you know, if you're in early care and education, you kind of start helping parents early on, come up with strategies. You know, how are you going to deal with homework? It's tough. Kids don't want to do it, right? Parents are tired. It's the end of the day. They've worked all day. Everybody's cranky. And that's when people have a lot of issues. So that's my own little plug about ways that schools can work with families, you know, link up families that can help each other, have homework I don't know, homework hotlines or something like that. Think about social media and ways that you can use that. Give the parents the answers to the homework. I tried to help this one little guy I was working with his math, and he was like in 3rd grade. I couldn't figure, I'm like, I don't understand this math. And I always thought I was pretty good at math. So anyway, so we'll talk a little bit about concrete supports, and concrete supports are one of my favorite protective factors because as the nice lady that introduced me said, I was over the TANF, Temporary Assistance for Needy Families, which you call CalWorks here in California, and the food stamp, which you call CalFresh. It's actually SNAP, Supplemental Nutrition Assistance Program. So CalFresh, CalWorks, and I was not Medi-Cal at that point in time, but Medicaid. These are obviously critical pieces for families. And like my mom, who was the mom that I worked with, who was homeless, you know, it's really, really hard to do what you need to do with your family when you don't have basic needs being met. So concrete supports are, it's having services, but it's also being able to access those services. One of the things that we talk about with concrete supports is a lot of times we'll give people resources, we'll send them someplace and just kind of to give them a resource and send them on their way. But a lot of times those resources are either out of money or they may not be eligible for the resource. Or it's probably more like an and, you know, it's a long process to try to access those things. So one of the things just to think about as in your role is, you know, one of the gals that I work with, she went and she tried to, I think she was getting immunizations for her kids. So she went to a local clinic to see what it was like, just to check it out, because she was sending a lot of her families. I think she was working in Head Start at the time. So she would say, oh, you need immunizations? Just go to the clinic, you know, it's right there. Well, she said she was shocked at how long it took, at how crowded it was, how difficult. Now, we don't have control over that in our lives, right? We don't control the public health department and how they run their clinics, and we don't control, certainly not the temporary CalFresh and CalWorks and how long and arduous a process it is. But what we can do is at least say to folks, you know, sometimes when you're applying for these things, it's going to take a long time. You got to be persistent. And, you know, this is something that I heard about. And again, that's where social connections are so good, where other families can really share what worked for them. Like, oh, I went and talked to this person, and that really worked for me. So people get, I always feel it's about managing expectations. You know, if people expect they're going to go somewhere and like that, they're going to get what they need, they're going to be disappointed in most of the social service programs that we run, because unfortunately we have rules and we have requirements and it can be a little bit tricky. And then we talked about also, you know, the school becoming a community resource. That's really, that's such a wonderful thing. If that's a place where people can come and just know that they'll get some information or advice. Oh, I'm having a little problem with my one piece of paper here. So how do concrete supports buffer families against child abuse and neglect? Well, clearly, you know, you need to meet those basic needs. But even more so, we think about mental health and substance abuse treatment services, domestic violence programs as also a concrete support. It may not be for food or shelter, but another piece of, you know, your sort of hierarchy of needs is really that need for safety. And so substance abuse services, mental health services, and domestic violence programs are key services. And again, when you go back and we talk about how the protective factors interrelate, that resilience, that trusting relationship that you have with families, it's really hard to talk to people about, I think you need mental health services. You know, Johnny, I think you need to go see the mental health counselor. But you know, if you have a good relationship with somebody, then you can really talk to them and you can say, you know, I'm really concerned about how you seem really stressed. Here are some resources, and even better, how nice it is when you can say, and you know, I've also had to access these resources. Frequently, when I'm talking with the CASA parents that I work with, they're young. You know, they're young people, and they have young children primarily. And I say to them, you know, I know what you're going through. You're co-parenting with another, you know, the mother of your children that you don't get along with. That's really hard. I went through that. You know, we went to counseling, and that really helped us. So I try to use the things that I've experienced in my own life to try to really help folks and say, you know, there's no shame in asking for help. Being able to ask for help is a sign of strength. But the stigma is still there, unfortunately. And then what you can do, you know, you're not going to be the place where people are going to get all their needs met, but you can have resource boards. You know, at our Family Resource Center, they just put up what's going on in the community. Free things, fun things, things that families can do that they can do together that are safe in communities where maybe they need the access to recreational opportunities. You can't provide all the services, but you can help people access them. And again, it's about stigma. I work with some AmeriCorps kids, you know, the young people who are in the AmeriCorps program, and one of the things, because they get a very low stipend for full-time work, we say to them, you know, you're eligible for food stamps, so go down and apply. And you'd be surprised, young people who say, you know, food stamps? Isn't that like that's what poor people get? I'm like, no, it's to help supplement. It's called supplemental nutritional assistance. It's to help supplement your budget, and it really is helpful. Okay. All right. And then this one, I think you might know a little bit about knowledge of parenting and child development. So clearly, understanding child development really, really will help parents really help children achieve the most that they can, and can also help parents be more resilient. When my son was young, he was a challenging child. I'll put it that way. You know, he knew what he wanted, and he wanted to get it, and he could be a little difficult at times. So I would go to work, and you know, you'd see somebody in the hall and say, hey, how's your so-and-so? And they say, oh, my so-and-so's wonderful. You know, she's in soccer, and she does this, and she does that. And they'd say, and how's Chris? And I go, he's a pain in the ass. That's how he is, right? And they'd stop and say, well, you know, I'm having a problem with my kid, too. And what I realized was a lot of times we don't share those negative things because we think, I don't know what we think. For me, that's how I function. I function well when I'm sharing my issues and concerns. But what I learned from that was, once I would say, yeah, my kid's a pain, and I'm having a really hard, I'm struggling right now with this behavior, that behavior. Then I would hear from the parent, I'm struggling with that too. And then they would feel more at peace, and I'd feel a lot better too, because you feel really kind of bad if you think it's your parenting that's the problem. Oh, question? Can you say more about parent-peer support? I will in just a moment, because we're getting to that in just a second. So just bear with me. So in any event, clearly understanding what's within the norm for that child, really helpful. And also for families who have children that have behavioral issues, those strategies. The parents that I work with in the Child Protective Service System, they are all in parenting class after parenting class after parenting class. Some of them have graduated from the same parenting class like 3 times, right? But they're still not getting what it is that they need to understand. And one of the reasons is because they're really, the parenting class isn't really addressing the challenging issue maybe they're dealing with. So one of the things that's really helpful, and what they learned, the Center for the Study of Social Policy, from these exemplary programs, is they gave parents an opportunity to learn about parenting issues that they're dealing with in real time. So whatever it is that they're struggling with. And they also gave the parents an opportunity to see their child succeeding and look at strategies to try to help that child succeed. So that's really important. And then, of course, how does it buffer parents and families against child abuse and neglect? Well, one of the real problems that we see over and over again is parents that don't have the right understanding of what their child should be doing for their age. So they think that their, 2-year-old should be potty trained, and they are really upset and angry over that. So understanding can really, really give you a feeling of, okay, I can deal with this. I understand. I just need to, do X, Y, or Z. The other thing is the overuse of corporal punishment. One day I was in court. I was waiting to go into the courtroom, and there were a group of parents, all in the CPS system, and they were talking about what constitutes abuse. And I was laughing, in my head. I mean, they're going, well, is it a slap? Is it this? Is it that? And I thought, that's not the right question. The question really isn't what constitutes abuse, but rather, how can I positively discipline my child? What are the ways to positively discipline my child? So that really said something to me about perhaps the parenting classes that we're using. It's really not about whether you hit your child or you don't hit your child. I mean, there's a lot of folks out there that will say to you, I mean, after that one particular football player was arrested for hitting his child, and somebody, one of the spokespeople on television, a football player or a sports guy, made a comment about, well, all African American families discipline their children this way. Well, first of all anything that is never accurate, but also, again, that's really not the argument we need to be having. What we need to do is kind of figure out why do we feel the need that we have to use physical punishment, and what are some alternatives? A lot of the families that I work with really don't think there's an alternative way to get a child to behave. I mean, they're convinced of that. Very, very convinced. So, that's something that we really need to work on, I think, as a society. And then, of course, what we talked about, learning what to expect, and those behavioral management tools when children and children are difficult. You work with them, right? Children are difficult. They're cute and everything, but they're really, really difficult. So what do you do when you have those difficult behaviors, and how do you then make that positive? And then, of course, what can you do? And we talked about, informal daily parent-staff interactions, parent education, lending library, and the opportunities to observe positive discipline. And I know for myself, when my son was little, and I would go into the child care center, we would talk about things that were happening, and they would give me some tips and ideas, and that was helpful. And it always made me feel good when I saw him behaving positively. Might not have been behaving positively for me, but I knew he could do it because I could see it happening in the school setting. And then last but not least is children's social and emotional competence. And this is the only protective factor that focuses specifically on the child. The rest of them are really about the family, the parent. But, and this is, again, your bread and butter. This is what you all do in your day-to-day interaction. And children that are socially and emotionally competent, they're ready to go to school. They know how to behave in school. They know how to articulate their needs. And as I often say, there are some adults that we work with that we can see never really developed that social and emotional competence that folks need. But the other thing I just wanted to mention on this protective factor is if you go to the Center for the Study of Social Policy's website, and I know it's a lot of information, but just write down Youth Thrive, those two words. They have they've taken the protective factors and they have developed a framework for what they call youth that are at risk or in risk. Youth that are in risk. And the Youth Thrive framework, most of the protective factors are focusing on families of younger children under the age of 8, primarily. But the Youth Thrive focuses on the adolescents and young adults. And they take the protective factors and very, very simply and in a very similar fashion mirror them to what youth need. And they've done a very similar work where they've identified for these children, these young adults that are in risk meaning they're already in the Child Protective Service system. They're already in foster care. They're already in the juvenile detention, the juvenile system. And they looked at what can help these children, young adults, thrive and really promote their well-being. So I just want to mention that here. And the other thing about social and emotional competence, as we know, if it's not as if you miss your opportunity to develop it, you're not going to be able to develop it. You can develop it at any time. And it's really a part of what we do throughout the child's life cycle. And social emotional competence helps buffer families in very, very concrete ways. I mean, children that are socially and emotionally competent can perhaps learn to say no. They can talk to a trusted adult. And, a family that I work with that has had multiple Child Protective Service cases, one of the children in the family was a perfect example of this, where he knew something wasn't right in his own home, and he went and talked to his teacher. And, ended up, we went back into the home and, working with the family. And that to me was such an indication of he's a little bit older, that was such an indication of his social and emotional competence. The kind of things that were happening were not considered normal to him. He had moved beyond that and felt, that there were other things that he wanted to see in his family. And I thought that was just a wonderful progress for him. Also, and this is the key, and this is really for all of us why we're here, right? We want to build socially and emotionally competent children so that you can break the cycle of abuse and neglect, so that these children can parent their own children in a way that may be better than what they were parented, the way they were parented. And then how can you do this, and what you can do? So, you do this in your day-to-day work. It's such a part of what you do, is teaching children how to be socially, emotionally competent, but also working with the parents. And I love at the bottom of this slide the offering arts programs, because it comes back to that parental resilience when we talk about, parents having a positive feeling about parenting. Having fun with your child, just playing and having a good time is such a great way to build social and emotional competence. It's so simple, and that's what it really comes down to for me. Okay. And so we talk, just in summary, sort of the strengthening families approach. So what makes this such a great approach in my mind is that, it is universally available. You can do it anywhere. You can do it in schools. You can do it in hospitals. You can do it in doctor's offices. You can do it in social service agencies. And you focus on what's going well with the family. We say what's strong, not what's wrong, which is kind of cute and catchy, but it's really about, all of us, when somebody approaches us to tell us what we're doing wrong, we kind of turn off. But when people start with what you're doing right and how they want to help you do more of that, that's very powerful. And then delivered in partnership with families, which we're going to talk more about in just a moment. And then those very small but significant changes. And for me, I think about it like building a house. Maybe you move into a home and you'd love to have it, add a bedroom and change this and put in a new kitchen, but you can't. So you make some small changes, but they make a big difference. And it's the same thing in our lives. You don't have to do big, big changes in the way you work with children and families. Just small changes can make a huge difference. And it's what you're already doing. You're already doing these things. Oops. So these are, I'm just going to very briefly touch on this slide. These are 5 ways that the Center for the Study of Social Policy talks about how you can integrate the Strengthening Families framework into your work. And I have building parent partnerships in red because I just want to talk about them specifically. I mean, the other ones are very clear and simple. Deepening knowledge and understanding, that's what you're doing. You're getting the education and learning. Shifting practice, policies, and systems, that's when you go back and you work on things and change things so that you can implement the protective factors. And assuring accountability, you just try to see if what you're doing works. Is it helping? Is it better? So let's talk about building parent partnerships. So why build parent partnerships? Well, clearly the family, the parent, they're the first teacher of a child. They're the center of the child's life. And, highly involved families almost double the positive odds for their children in their education, their health, and their social and emotional development. So that's that, and that's why you work so closely with families. So we're just going to talk a little bit about how to make that deeper. One of the key things to remember, and it might seem obvious, but a lot of times people don't think about this, is to be inclusive. This is a picture here of what they call a parent cafe, which I love the way this room is set up because it's very much in line with the parent cafe philosophy, which is that when you bring folks together, you don't have to make it so formal. That's really hard for parents to feel comfortable in, but make it feel kind of fun. And like this is an opportunity to socialize, putting down these little, the tablecloths. It just gives a different feel. So that's a picture of a parent cafe. Make sure that dads feel welcome. Make sure kinship caregivers feel welcome. Make sure families, LGBT, lesbian, gay, bisexual, transgender parents feel welcome. And of course, families that have special needs or have children with special needs. When people walk into your school or your child care center or wherever you work, what do they see pictures of? What kind of pictures do you have up on the wall? That makes people feel comfortable. What kind of books do you have? That means a lot to people. A lot of times you don't realize that, again, small but very significant changes. And then you can formally and informally. And, again, schools, you do this all the time, volunteer activities, inviting parents in to help out. My sister's at a school down in Washoe County, and they have the parents in the office. The parents are everywhere. And that really is a great way to make them feel a part of the school. Hiring from the community, hiring community members, formally forming parent advisory or governance boards, scheduling events where you appreciate your parents. As a CASA, once a year they have a CASA appreciation event for us, which it's wonderful. It makes us feel really good about being a CASA. And then create a fund to support parent events and providing space. That's a big thing to just say, here is a place where you can come, there's a library, there's a place where you can meet, and then hosting community and parent cafes. And I'm going to, again, send you back to the CSSP, Center for the Study of Social Policy website. They have a great, very, very simple primer on parent cafes, how to do them, how to include, what to include, et cetera, all on their website. And then posting information about community issues and opportunities, voting, bond issues, fun things to do in the community, things that are free. And then informally, and this comes back to what we talked about with resiliency, making parents feel valued, modeling that warmth and commitment and the cultural competence. Conflict resolution. I mean, there's always going to be conflict. And I was as guilty of this as anybody. When I started as a CASA, I used to say this, and many of us did, it's not the kids that are hard, it's the parents, right? But then I realized, much of it because of the work I do every day, the parents are what the kids, that's their family. So, you can't exclude the parents. So now, probably I 50-50 my time between being supportive of the parent if they want me to help and working with the kids. And what I have found is the kids love the fact that I know their parents so well, and the parents love that I know their kids so well. So it does work. And then, of course, that physical space, having that place where parents can go. And then the last one, but again, the most powerful, ask parents what they want. A lot of our programs don't ask, what do you want out of this program? Survey them. What do you need? What are the issues you're dealing with? I talk about the homework because I see it all the time. But I think that is something that a lot of families really struggle with, how to be positive in that environment. And I just thought this was a great slide and a great thought. Vernia Myers, and she wrote a book, and it's called, hold on one second, because I don't remember anything if I don't write it down. Moving Diversity Forward, How to Go from Well-Meaning to Well-Doing. So that's the name of the book, Moving Diversity Forward, How to Go from Well-Meaning to Well-Doing. And if you Google Vernia Myers, it comes right up. But this is her concept, that diversity is being invited to the dance, inclusion is being asked to dance. And if you think about that, That's true. You know, if you feel included, it's because you really feel a part of something. You're not just sitting at the table to be the parent in the room, but rather you feel comfortable. You offer a suggestion. People, you know, you're a part of the decision making. Okay, we're doing good on time. I'm happy about that. So what does all this mean for the work that you do? So again, you're already doing this. You're doing those strategies. You're using, well, one of the things that is really helpful is where you can think about the protective factors in a way where when you think about a family, and let's go back to that family that hopefully you thought about at the beginning of the presentation, when it may even be your own family, but you think about that family and think about what do you do working with that family to build social connections, to help them identify concrete supports if that's something that they need, to help them with their resilience, help the child's social and emotional competence, help them understand their child's development and growth. And that's intentionally building those protective factors. And when you're working with the family, whether it's your own or somebody else's, are you working in partnership? I heard a speaker the other day, I don't know if you, Van Jones, he's from the Oakland area, a community activist, and he worked for President Obama. He wrote a book about the green collar economy. And I just thought it was so great. He was talking about the concept of solidarity, not charity. And when you think about it, that's really what we're talking about when we're talking about being in partnership. You're not giving parents what they need, but you're working together with them in solidarity to identify what they need and to try to help find it. And hopefully the next step is, if it isn't there, as a community, you come together and you demand it. But then we're going to a whole nother area, community organization. We won't go down that road right now. Okay. And then I just wanted to, again, oh, sorry. So how do we do this, creating this new normal? These are those 7 program strategies that you have listed on that logic model slide. So there is actually, now I have to kind of take you back a minute. So the Center for the Study of Social Policy, in your, you have a slide that doesn't look like this. Your slide says program self-assessment, and it has a picture of a Strengthening Families program self-assessment, and it says strategy 1, facilitate friendships and mutual support. X that out. I didn't have a chance to update this. Just recently, I mean like 2 weeks ago, the Center for the Study of Social Policy revised all their program self-assessments. And what they did was they organized them a little bit differently, made them a little bit simpler, but what I thought was really great, and I'm still looking at them myself, and you should have this one page. Okay, so, and also on the Edmodo site, I put the link that will take you directly to this program self-assessment. Warning, they are very long. But what this program self-assessment helps you do, it's now organized by the protective factors. It used to be organized by those 7 strategies, but that was a little confusing for folks. So I'm happy to say what they've done now is they organize it by the protective factors, and then they put the strategies that help build that protective factor within each. So this is just a sample of the first page of parental resilience. So they have 4 different self-assessments that programs can utilize. One of them is specifically for early care and education. And that's the, oops, get back here. Oh, wrong way, sorry. That's the first page of the center-based early care and education. They also have one for family child care that a family child care provider can use, or like a child care resource and referral could use working with a family child care provider group. Be a really fun kind of cafe activity. They have one for home visitation organizations, and then they have a general one for all community-based organizations that provide more different services. It's like 54 pages long, okay? However, if you're interested and you're thinking, like, I want to know how I measure up in building this protective factor in my early care and education center, and it would apply to a school as well. I mean, you just take a little bit of a leap there. You can break it down by, do one protective factor at a time. You could do one page at a time and just do one particular strategy. But it's a really great way, and it's a very powerful tool if you were to say, maybe use it as a way to work with parents. One of the things that I think is really fun when you're doing program assessments like this is to have different levels, like have your parents, have your program director, have your teachers, have everybody fill it out individually, and then come together for like an hour and look at what do you all think about how you measure up in these particular areas. So you have access to this assessment tool. It's a great way. People always ask, well, how do I do this? This will tell you. This will give you those specific strategies for how you can do it. And then you also have an empty petal chart. And I love this chart because, and again, Center for the Study of Social Policy came up with this. This is their concept of, look at, families and the protective factors in the middle. Imagine, and you can, it can be tailored for any group. I put education at the top because I'm talking to you all today and you're educators. So if I were talking to people in CPS, I might put them on the top. But really what it asks you to do is look at all the different agencies that you work with that affect the families that you work with, and think about how powerful it would be if you all came together and said, we are going to make a point within our own individual agencies to build protective factors for our families, and then strategize how are you doing it, because everybody has a role to play in building protective factors, and then think about how much easier it would be for the families if the Child Protective Service system and the Children's Mental Health system actually communicated with each other and worked together to try to support families. As a CASA, one of the main things that I do is just try to connect all those different petals together so that they know what the other person's doing. It is amazing to me sometimes the simplest things that people do not know that would make their jobs so much easier and make them so much more effective working with children and families, especially families that are touching all these systems. Okay. So, and the last but not least, these are all the resources, not all, these are some of the key resources. The CSSP resource, the website, the strategies website, where I would highly suggest if you go and you get on our mailing list, it's very easy to do. You just sign up and then you'll get information about all the trainings that we do. We also have, in addition to in-person trainings, we have webinars. So, if that's easier for you and you enjoy a more remote experience. And then also the California Network of Family Strengthening Networks, they have wonderful, wonderful tools that will help in integrating the protective factors. And the build at the bottom, that integrating a strengthening families approach into early childhood system development, that's an excellent, excellent tool. It's much shorter than the program self-assessment, and it looks at your agency from a systems level. And it's a very, very helpful thing. So I hope I answered the question about the parent peer support. And if there's any other questions? If not, no? Okay. All right, well, I am the time Nazi, and it is 12:10. So, and stay connected with us. We have our, we are on social media. Yay! So, well, thank you so much for your attention. I hope that it wasn't too much information, and have a great lunch and a great rest of the day. And if you need to get a hold of me, you also have my email address. I'm happy to answer any questions. Feel free to reach out to me. Okay? Thank you.